Types of RPD. Removal partial tension. Metallic RPD or removal partial tension. Hydraulic and temporary RPD and other forms of removal partial tension. What are the other forms? Unilateral, similar, overlay or removal tension. Implants of the RPDs. It will also be seen about the attachments for RPDs. Metallic removal partial tension can be treated and tissue supported or tissue supported RPD alone. Types of temporary RPDs include TPD, interim RPD, transition, treatment, and immediate RPDs. What are the other forms? Let us see in detail. Unilateral, unipartial denture. It should be used with caution, as the chance of the denture becoming dislodged and aspirated is too great. As the name suggests, unilateral means it's going to be external only on one side of the edge. Bilateral RPD is going to restore missing tooth and extend the bone both sides of the dental arches. With these images, you'll be able to understand the difference between the unilateral and the bilateral RPD. So when is unilateral and normal partial dentures fabricated? Of the comes product into the buccal lingual surface of abutment must be parallel to resist that intrusions, and written parameter should be available on the department and lingual surface of each abutment. Speaking of RPD, it has extensions into the undercuts of the labial surfaces of the teeth. Consists of labial or buccal retaining bar hinged at one end, one locked with the latch at the other. Together, both are reciprocating lingual plate to gain the maximum retention and stability. The bar incorporates rigid struts or an acrylic veneer, which makes the processes immobile. And we can see the longitudinal struts are mounted in the labial side with patients using key abutments and reduced movement support. Gagging for the patient is going to be very common with this, but it also used in cases of maxillary defense. Contraindications. Overall hygiene, high smile line because of aesthetics, soft tissue limitations, certain malappeasement, and alveolar limitations. What are the advantages of sewing for properties? The denture can be particularly helpful by the remaining natural teeth of a very little undercut for conventional glass pretension. As this type covers a considerable amount of gingiva, the standard of back control will be high, and that is a big disadvantage of this type of RPD. Next is overlay removal partial denture. Any removal dental process is constructed over one or more remaining natural teeth, the roots of natural teeth, and or dental implants, providing additional support, stability, and retention is called as an overdenture or an overlay processes. The endodontically treated abutment is prepared by removing the clinical crown few millimeters above the free gingival margin to create a dome shape separation with a lightly chamfered margin extending slightly subsequently. The entire height of the abutment can be around 2 to 3 mm above the gingival margin. So the angulation is going to be 15 to 30 degree. The metal coating will be made and cemented over the removal partial overdenture is then completed in the usual line. Advantages of overdenture: preservation of alveolar lines, preservation of remaining teeth, preservation of proprioceptive response, enhance neuromuscular control, occlusal awareness, and biting force, improve crowd nutrition, support and stability, good retention, patient acceptance because they have the feel that their natural tooth is retained, and causing a good or improved psychological benefit. Conventional dental procedures are only kept. Disadvantages is that the periodontal breakdown of the abutment tone is possible over the long run, carries susceptibility if the dent is not maintained properly, and the bony undercuts its limitation of the path of insertion. Inadequate reduction of the abutment may cause increased vertical damage, encroachment of the intraocclusal distance, and aesthetics. As I said, the abutment height could be around 2 to 4 mm above the gingival line and not more than that, because that will in turn increase the vertical dimension of the denture that you fabricate and eventually increasing the vertical dimension for the patient. Interference with proper setting up of teeth, that is proper teeth setting, would be difficult if the abutment height is going to be more, and then you will be fabricating medical pin over it. The height will be increased, and fixing a teeth over that will be difficult. Expense and time consuming. Molecule. What is implants of phototherapy? When there is a lack of adequate support of soft tissue, that will result in displacement of bilateral and unilateral distal extension areas. Placement of implants is one of the options for managing this problem. Dental implants effectively convert the Kennedy's class 1 or 2 denture to a Kennedy's class 3. This type of overdenture gains support from both the dental implants and internal tissues. Implants support the overdenture provides better stability of processes and reduce the bone resorption. So the basic for implants supported RPDs, we will be placing an implant and giving their processes in a partially ridiculous situations. Coming to the attachments for RPDs, classification of attachments based on their location and design can be classified as attachment retail, partial denture, attachment retail, partial over denture. Attachments for partial denture could be intraocular stop attachment and extraocular stop attachment, whereas the attachments for over denture will be stud, magnetic, telescopic, and bar attachments. What are the uses of attachments in removal partial dentures? They are going to help them improve the aesthetics, retention, and function. Intraocular attachments. Metal receptacle or a female that will be the matrix will be incorporated entirely within the contour of the crown. For example, when you are preparing a rest or a rest seat down the window, you can incorporate a female onto the abutment surface. Clo- Closely fitting component or the matrix on the main part will be incorporated within the denture. As you can see, the crown will form the tooth surface is going to be the female part, and the male part will be fabricated within the denture, and the entire processes will sit on to the abutment. Female portion of the attachment is within the crown. What is extraabdominal attachment? It is the portion of the attachment outside of the crown of the retainer, be it male or female. For extracornal, the crown is here, and the attachment is normally extending outward from the crown. This is extracornal. Whereas intracornal meant for the attachment to be within the tooth surface during preparation. Hence, this minimal tooth reduction is necessary. As you can see from the images, the attachments are extending outside from the tooth surface. Part here is attached outside the tooth surface, and the other part is going to be attached to the denture, and this will seat onto the extracornal attachment. What are the disadvantages of this technique? Extra tooth preparation for intracorneal attachment is mandatory because of the duration of the attachment space. If insufficient reduction is done, over-counter retainer is what will be fabricated. They are used contraindicated in cases of short clinical crowns or large pulse of dexterity problems, and in patients having paraprofessional habits like susceptibility. What are the over-denture attachments? We've seen the attachments that are used for the partial dentures and extracorneal and intra. But for over-denture, there are four different types of attachments. That are stud attachment, magnetic attachment, bar attachment, and telescopic retainers. What is stud? It consists of a main part, usually attached to the letter unit, cemented over the prepared abutment. There is a reverse component that will be cemented over the abutment and female housing embedded within the fitting surface of the tension bases. You can see stud attachments. The male component is going to be with the abutment, and the female component is going to be with the dentures. So the female component will be housing into the abutment. Motive attachment. Small, strong weaning magnets will be used. One will be cemented onto the prepared cavity wall. The particularly environmentally treated and other will be attached to the denture base. Maxillary mandibular removal everyday dentures using magnetic attachments can be seen in this slide. The first slide depicts the placement of two magnets, and when followed by 1.6 in the next image. This is the case where the magnetic starts to defect was restored by a magnetic attachment supported on fading. What is bar radiation? It's a bar formed to cutting the attachment teeth together, run parallel, and overlay the residual bits, provide support and retention for denture and sprint of the teeth. Bars may be form of preform metal or polystyrene. As you can see, the bar is a transverse line connecting teeth to organs. The sleeve or a clip will be fabricated within the denture to swat the bar. What is CAD-CAM bar? The application of CAD-CAM that is computer-aided design and grading manufacturing. Application of a broad range of formula may simplify the laboratory process of the image. That is, the entire that is bar attachment that is fabricated conventionally can also be done using CAD-CAM digitally. The CAD-CAM system was utilized to produce a lightweight titanium overdenture bar with locator attachment in the case report. What is telescopic overdenture? The telescopic overdenture is milk primary complex with parallel walls, and the denture will have a secondary component. Retention is gained from friction due to the parallel walls of the primary fitting and precise fit of the secondary fittings. And is now simpler to use. In telescopic overdenture, we will be fabricating two metal objects. Once the abutment depth is reduced to the desired size, we will be fabricating a metal fitting that is called as primary metal fitting. And you have to make sure that the walls of the metal fitting are clean so that when you are fabricating a secondary coping, a coping over another coping, and the secondary coping is going to be within the denture base. That is called as telescopic overdenture. So when the two metal copings, eventually they are going to get attached only through friction. So this friction retention is used here to tolerate overdentures. This fixed removal partial denture. The replacement of missing tooth and restoration of angular power. Situations of trauma and cliff-lip and palate and after the surgical excision of prosthesis. Reduction of the surrounding volume of fans of tissue is even more pronounced. The best example is Andrew's bridge. Andrew's fixed tenured prosthesis was first synthesized in 1976 by James Andrews, consisted of a bar soldered to the retainers at each end, onto which a denture is clipped. As you can see in the second image, it's a bar connecting the magnets, and the denture will be clipped onto the opposite surface. Indicated in extension of developmental scholarships and unfavorable skeletal relationships. What are the type of partial overdenture? Is visual denture. It's a denture with a hole, as you can see in the line, lined by a gasket of silicon fiber. The holes thus provide space for the mining naturally emerge into the bone cavity through their pollution. It is an innovative approach to preserve the few remaining naturally. This venture is simplest and very special impression techniques only also environment. As you can see in the image, Komolas are present in the upper image within completely dangerous movement. So to preserve the remaining natural plants, holes are created in the upper so that the denture can be supported by the remaining tentacle. It is an excellent option for patients who want to replace their music teeth but retaining their very few remaining teeth. Preserving running their routine, however, costing and technique, retention and stability of dentures. It gives the patient psychological satisfaction of retaining the natural teeth. What are the limitations? Hygiene maintenance, caries potential, periodontal risks, minor lifespan, in cases of soft blindness, if they have use lifespan is going to be flexible hinges. Biocompatible nylon and polyplastic present flexibility and stability. These have a color, shape, and design of a wow plus versions blend with natural appearances of gingiva making processes, nearly invisible. We can see in the images, the lenses are very flexible than the conventional clinching processes. Strength of Valplast resin doesn't require making filming, and it eliminates the metallic taste. Enables passion to be fabricated thin and metallic. That's everyone would not to be any metallic slabs, metallic. So to conclude, the choice of the RPD design should be based on knowledge of as well as mechanical reasoning. The dentist responsible for the treatment and must be able to justify the design for each case in keeping with this. Thank you.